Hi, I'm Dr. Rahul Bharad. I welcome you all to my series What Life Has Taught Me Yesterday. Today when I'm recording this video is 26th of May 2023. I'll be talking what 25th of May has taught me in life. We all know hemoglobin is known to many people. Hemoglobin is very important in our blood. It makes our blood color red, and that is an important aspect in our life. Hemoglobin less is very common. It is called anemia, but there is another term which is the opposite end of the anemia, which is polycythemia. Now very few of the people who are not doctors, they may not know what is polycythemia. Polycythemia is the increased hemoglobin. Means if your hemoglobin levels are less than a particular value according to your age and gender, it is called anemia. Similarly, if your hemoglobin levels are more than expected, it is called polycythemia. So this polycythemia is very common in preterm babies. Some of the preterm babies, they have polycythemia also in NICU. Various factors lead to polycythemia, because when the baby is in the womb of the mother, there is reduced oxygen supply to the baby sometimes because of some conditions like hypertension in the mother, pregnancy induced hypertension, etc. And because of that, baby's body tries to make more hemoglobin, and in that process baby gets polycythemic, that is hemoglobin level more than necessary. What happens because of that is that there is more production of RBCs because of increased erythropoietin hormone, and because of those raised increased number of RBCs, blood gets thicker, blood gets more and more hematocrit. Now what is hematocrit is, it in short it indicates the how thick the blood is. So polycythemia leads to more RBCs in the blood, which makes the baby look very reddish, and sometimes it may lead to reduced platelets and so many other complications like reduced sugar and reduced calcium. So one of our baby admitted in our NICU had this issue. So we what is the treatment for above a particular level? If the hemoglobin levels are above a particular level, we have to do a process called partial exchange. Now in that partial exchange, we withdraw some amount of blood, at the same time we give same amount of normal saline to that baby. This is done over a period of 15-20 minutes. Gradually we have to do this procedure, and after doing that procedure, if a fixed volume of the blood of the baby is replaced by normal saline, that baby's hemoglobin drops to normal level than the exaggerated level which were present before the procedure. And that is the thing. So why I am telling you about all this is that we all should know at least there is a term called polycythemia. It's a very simple procedure. If needed, that procedure is must and after doing that partial exchange, baby is fine. Baby's hemoglobin levels will be reduced to normal levels. Yesterday we did that procedure of partial exchange in our hospital. After that, today we'll be doing blood test to see how much hemoglobin has come to normal levels. Most important lesson we can get from all these procedures and all is that polycythemia is a possibility in some of the preterm babies, especially those where mothers are having some blood issues or placental issues. And if needed, that procedure is simple, very easy and very effective. That is the most important lesson and most important message I wanted to convey with you all, because if properly counseled to the parents what is the need of the procedure and what is the advantages of that procedure, all the anxiety will go, and that procedure, if done properly, it will not cause any harm to the baby, rather it will have so many advantages. So that was the most important lesson I got from yesterday's life, that counseling of the parents was important, and doing that procedure in a timely manner would definitely help the baby, and that's what exactly we did to that baby. Most important news I came across yesterday is about a signal. Now European Astronomical Society has sent a signal from an orbiter which is around Mars, and from that Mars they have sent a signal to Earth. Now they are trying to decode that signal. Nobody knows what is there in that signal, but they are trying to learn, if at all some alien signal comes to Earth, how to decode it. That signal was sent by an orbiter near Mars, and after 16 minutes it reached Earth. Now what is that news is all about? I'll be sharing link in the description box. If you want to read more about that, please go to the description box of this video and do check out that news. that alien signal has reached Earth, and now scientists are trying to reveal what is there in the decoded language of that signal. For today, we'll stop here. Bye bye.